In this video, we're going to look at elbow palpation. We're going to be looking at the bony landmarks you'd be looking for and also the soft tissue you'd be feeling so that you can make the most out of your elbow physical examinations.
So in a supinated position, the first thing we want to look for in the elbow is the distal bicep tendon, which is found in the cubital fossa. And we're looking here for pain and swelling, which may indicate some pathology of the bicep tendon. You can then find the radial head, which is found one thumb width laterally and distally from the biceps tendon. And you can rotate the hand from supinated to pronated and feel the radial head rotating under the fingers. You can palpate then through the biceps muscle belly, and you could be looking out for any Popeye signs which may be a signal of a ruptured bicep tendon proximally. Medially, we can palpate the medial epicondyle of the elbow. If we go slightly distally to this is where the common flexor tendons originate from. We can then palpate into the muscle belly of the common flexors of the wrist. We can also palpate the cubital tunnel, which sits between the medial epicondyle and the olecranon process, and this is where the ulnar nerve runs through the cubital tunnel. So if you've got any tingling paresthesia that's going down into the hand, particularly the little finger side of the hand, then you may want to do Tinel's test where you tap on that area to see if it reproduces symptoms. Then we can look laterally with the hand in pronation. We can palpate the lateral epicondyle and slightly distal to this where the common extensor tendons attach. If we go proximal to thumb widths where the extensor carpi radialis longus attaches into, this is the anterolateral supracondylar ridge. We can also palpate into the muscle belly of the common extensor muscles. As always, we're looking for deformity, swelling, heat, laxity, tone and pain, which will signal different pathologies of the elbow depending on what you find.
If you're a physio or therapist looking to get better, then press the subscribe button, click the bell icon, and that way you'll see all our current videos that are coming out, and they're all designed around helping you to get better. Guys, if you enjoyed this video, then click this one here because you are going to love it.